Because of volume, because of relations that we have built over the years, these hospitals will give us a lower price than what it would cost somebody to go and just call around and do it themselves.
Hello everyone. Emily Bron here, owner of the Lifestyle Consulting. And as promised, today I have my dear guest, Dan Heffley, CEO of Salud Health USA, and many other things that I believe Dan will share with us soon. Hello, Dan. How are you?
Good morning, Emily. I'm well. How about yourself?
I am okay. I am looking forward, even with all my knowledge and practical experience about medical tourism, to learn from you about your experience, like from the different angle, and specifically being kind of on the helm of a medical tourism company in United States. So let's start. So a little bit about you, just before we jump to the matter.
Sure. As you had mentioned, I'm CEO of Salud Health USA, a medical tourism facilitation company, but I wasn't always involved in medical tourism. I had 20 years in the health insurance marketplace, and I also have a lot of experience internationally with hospitality companies. And that's really where I noticed the stark contrasts and differences between US style healthcare and costs and international style healthcare and costs. And it intrigued me. So I investigated it further.
Interesting. I can tell that I came to medical tourism exploration myself when I started to travel. First of all, when I lived in different countries with different medical system, and as immigrant, learn on my own skin, I would say, as the differences, and bad and good, and always comparing. Next country, you comparing how it was here and there, and with my kind of analytical mind, I was always trying to find how it's working as a system. And when I started to travel, interest. So what is a medical tourism in terms of Dan Heffley?
Okay. Well, medical tourism has actually been around for quite some time. It's been around over 20 years, and it primarily focused on cosmetic procedures because cosmetic procedures are not covered by health insurance. And most people here in the US have some sort of health insurance to help them pay the costs. But as health insurance started getting more and more expensive, people started looking for alternatives. And overseas, and by overseas, I mean the world, there's various different procedures that are available that are much less cost. They cost a lot less than what they are here in the US. The US has some of the highest healthcare costs in the world.
Do you have explanation why? Why so?
There's many explanations. I mean, I could go on and I could write a book about it, but primarily it has to do with the cost of the technology, the fact that America actually subsidizes the world. People don't know that. We actually subsidize the pharmaceutical industry because other countries have caps on how much drugs could cost. And in the US, that's not the case. That's not the case. So a lot of that falls upon the US. I remember back in 2000, I'll share this with you. Back in 2000, the World Health Organization did a survey of the best healthcare systems in the world. And the US came in at number 37.
Yes.
Number 37 in the world. Number one was France.
Yeah.
Number one was France. And I took issue with that, so I investigated it, and one of the things that I found was that and doctors, my wife's a nurse practitioner, so I'm behind doctors and medical personnel 100%. They do earn the money that they make, but one of the things that the French doctors said was, we don't need 2 vacation homes. We don't need 5 cars. So the salaries and the costs for the medical care. Also, there's something called tort reform that has been looked at here in the US, and it's very difficult to enact tort reform. What is tort reform? Tort reform is reducing the amounts of awards in medical malpractice cases. And that's one of the things that the French did as well. They didn't have the system that we have here, where you can have millions and millions of dollars in injury claims. They actually have a governmental entity that decides if medical malpractice has occurred, and they also have a separate fund for that to pay out of. So
I
they
see.
decide if it has occurred, and then they decide what the amount is. Now, I mean, you had asked, what are the drivers of costs here in the US? And that's just a few. That's just the tip of the iceberg.
Okay, but today we'll go to the medical tourism. Even it's all interconnected. Like why it exists, it's because of high cost in United States. Like I live in Canada, we have different medical system, which kind of free, but we are paying another price for this free
Exactly.
health system in a form of long waiting times. I attention with medical attention kind of that. And lately we started to supplement less and less, by the way, services covered by OHIP. OHIP, for example, it's my government insurance in Ontario, like every province has its own, and more we subsidize anyway. Like I will not about alternative medicine, but like acupuncture, which is alternative but recognized, or homeopathic, or some other types of treatments, which, by the way, normal allopathic in Europe, in Germany, where actually it was born, like as a in a big sense, it's completely different system, and it's all kind of recognized and subsidized. Don't go to the details. In Canada and United States, what is united us in this respect, it's dental costs. Like many people, and including me, started to look south, or would say abroad, when we have a certain dental problem, because the costs are just raising and quality it's not always satisfying, I would say. I personally found very good care. I was amazed by technology in Costa Rica. In Costa Rica, it's known kind of provider for medical tourism services in regards to dental, in regards to cosmetic and others. But what you would say, additional factors, and I believe you launched your Salud USA. What was the
Well,
main trigger?
I mean, you mentioned it. In addition to high costs here in the US, there is and I mean, I experienced it myself. I needed a procedure, and I was talked with, and the soonest they could get me in was 3 months. In 3 months from the time that I had called. And with medical tourism, we can get procedures scheduled in as little as 2 weeks. We can
Absolutely.
get it scheduled as little as 2 weeks. And the last thing that is, I mean, oftentimes there are procedures that may not be available here in the US. And every country has their regulatory procedures.
Yeah.
And the FDA, which oversees the US markets, they take a very long time. I mean, speaking just of pharmaceuticals, the average time is 7 to 10
To provide
before
what? To provide
a drug can be approved. That a drug can be approved
new
here in
drug?
the US.
You mean new drug?
Then yes, A new drug takes between 7 and 10 years to be approved here in the US. And it's just not just pharmaceutical. It's also, I know, relationship with a company that has an innovative gastric balloon,
Mm-hmm.
and they've been using it worldwide for many, many, many years successfully. And what it is, the person swallows a pill that is in actuality an actual balloon. It's connected to a mini catheter, inflated once it is in the stomach, and it self-dissolves. So it's a non-surgical bariatric balloon. And it's currently going through FDA approval as we speak. But it's been available globally, I mean, for many, many years.
I think my
Great.
sister in Israel did it like a couple of years ago. This procedure.
Yes,
Uh,
they are in Israel. They are
yeah.
in Israel. So
So tell me, please, speaking now about benefits about medical tourism. So I understand that actually the, I would say, size and maybe heaviness of FDA establishment in the United States, it's one of the reasons why it all takes time. How other countries, how Costa Rica, how Mexico, Israel dealing, because they have regulations as well, and with all
yes.
this kind of their prices, depending,
Yeah.
on what.
It has to do with what I mentioned before about tort reform but also labor arbitrage.
Mhm.
Okay. And that is how much doctors get paid. It's no secret that if you go to Mexico, for example, and you want to buy, it tends to cost a lot less in Mexico than for a comparable product here in the US. And the reason for that has to do with the cost, the labor arbitrage, which is what
Taxation.
people get paid to do the jobs, as well as exchange rates, involved. So there's many factors that do a lot of the hospitals
Mm.
that we work with. We have personally of our network was actually personally vetted. And what we found is the nurse to patient ratio was much better. There's a hospital in Tijuana we went to. My wife accompanied me because she's a nurse practitioner in a hospital system, and she was amazed. She was amazed at the level of care, number one, the cleanliness, number two, and then, of course, the ratio of nurses to patients. During the height of the pandemic, and again, this is an isolated case, it's like this all the time, but during the height of the pandemic, the patient to nurse ratio in the 1-to-1, 7 patients to 1
And in
nurse.
United
And I mean, it's no that we have a nursing
Yeah.
shortage. We have a shortage of nurses here in the US, and it is reflected. It's reflected in the load that's placed on the nurses and the number of patients that each nurse gets. So ICU, that's supposed to be 1-to-1. The optimal ratio is 1 nurse to 1 patient because they're in ICU. So, but overseas, it was pretty much 2 patients to 1 nurse in the general population, not in ICU. So the nurse to patient ratio is much better.
Okay, I think with this kind of sliding actually to benefit and quality of the services, medical procedure, because many people are Americans, Canadians, they with all knowledge about how it works and maybe some deficiencies in our country. But when I, for example, started in Mexico and Costa Rica, people were concerned because they, oh, I cannot trust here is a system. How I can trust in Mexico? I don't trust and I'm proving, again, it's my personal experience that I've had some concerns. Yes, it's the beginning, but I get over this fear, I would say. And I learned a lot. I know a lot of doctors, and I visited hospitals, maybe not like you, but quality, high quality benefits. But what you would say in this regard?
Well, I mean, anytime you travel, there is anything to go wrong. Okay. Your luggage missing, the language, so you might get long hauled in a taxi from the airport. And Americans are much more, in our experience, are much more of those things
Yeah.
happening. Now, extend that to your healthcare. Imagine you're going for a surgery where you're vulnerable, you're in pain. So, those sorts of things. And on the one hand, it's valid. But on the other hand, is there are ways to make sure that your experience is a good experience. And many people, take it upon themselves to do medical tourism on their own. They look solely at the price. They look solely at the price. And the key is to get involved with an agency. There is something called medical tourism facilitators.
Yeah.
Okay, obviously we'd love to have them use Salud Health USA, but there's other medical tourism facilitators that have made it their job to vet these providers, to vet the transportation, to vet the hotels. And some of them, Salud Health USA certainly does this. We provide a concierge service. So somebody that's actually stuck to you, that's bilingual, and that basically hold your hand. They hold your hand through the entire process. One of the we have that most of the others don't is that we don't rely upon just internet searches.
Obviously.
As I mentioned previously, we've walked the halls. We talk with the providers, and that's important. If you're going to do it yourself, try to talk to the provider. Talk to the provider, amenable to do that via, and because most people can't afford to have the procedure and go down previously just to look at the facilities. Okay. We've done that. We've done that. We've met the physicians, we've met the billing department, we've met some of the providers have a service that will shuttle you from the hotel to the clinic and back. We actually have drivers. We actually have drivers that actually will take you not just to your appointments, but where you want to go, where you want to go. Because if it's something that's not fully incapacitating, you're not going to want to sit in your hotel room while you recover. Okay. See the city, take a look around. For those that do it themselves, there is an organization that assesses quality. It's called the Joint Commission, and there is an American version called JACO, and then there's an international version called JICO, and it's the International Commission, Joint International Commission. And what they do is they go into the hospitals and they take a look at infection rates. They take a look at nurse to patient ratios. They take a look at hospital acquired infections, those sorts of things. And they give a stamp of approval if the hospital actually passes those.
Mhm.
And it's not something easy that they can get, that they just pay a fee and they get. I worked with a hospital in Colombia
Mhm.
that was a new hospital, and they wanted to get JICO accreditation, and they asked my help to get that. And it was a laborious
Mhm.
process. It's not something that they just pay a fee and it's rubber stamped. So if you're going to do it yourself, make sure it's at least a JICO accredited facility. And then also try to talk to the physician. And again, most of the surgeons are bilingual. The issue is the support staff is not. The support staff, the front desk, patient coordinator. Now, many of the hospitals also have an international department. So if you're doing it yourself, you want to focus on, that should be the first question out of your mouth is, do you have an international department that shows that they're dedicated to international patients? And the international departments will be bilingual. But understand though, even in that scenario, that person, and usually I've seen the international departments that I've seen only have one person. That person is not going to be with you 24 hours a day. So you will be talking with nurses, you will be talking with other support personnel that may not speak your native language. Important to try to find an agency, preferably one that actually provides either translators or best case a concierge.
My personal experience, just listening to all these good daily advices. So when it was, I think, 7 years ago, when a dentist failed me in Toronto area, I've had like long, like all life procedure and periodontic. Nobody wanted to take me, even like for no warranty, nothing, and falling down. And I was, oh my God, like what I gonna do? And I started to look around. I was in Hungary. By the way, I was very impressed by Hungarian dental system. Was in different topic, very strong. Like in Europe, you need to go to Hungary, even there is a good, because they have German methods and local prices, at least how it was 7 years ago. But I realized that like for dental, I need to go at least 3-4 times. And I was before then in Costa Rica, and I like Costa Rica. And I thought, okay, why not to combine it with vacation? And I'm kind of like to travel, like it's more convenient and better for North Americans. Actually, I've had not many issues in Hungary with English. Everyone was speaking English. In these clinics, like everyone is profi English or Russian, I didn't have problem. Speaking about Costa Rica, how I did my research, I started in rooms about the topic. I've had list of 10 clinics that I was researching one by one doctor's procedure, what tools they're using. Not yet Zoom time was communicate. I learned about all latest procedure in Toronto University Medical School, all latest on this particular topic and all this. So when I arrived, and doctor who I at the end to go with, he was one of the, I would say, expensive, like professor of the local university. We are friends till now. And practicing with very big practice over the years, he told, look, and he has facilitator and translator. He told he wasn't my facilitator because I was asking him questions. I don't remember now about this procedure, how we can move this implant and this area. Look, you're ready to be my assistant. But I understand that not everyone can spend so much time and attention to the topic. And I spent really, after then people told me so much about this one, why you will not start doing it, advising somebody else to do. It's how I started kind of to work after this. And I was traveling, and at the same time, okay, my doctor, my Costa Rica professor told that I'm the example of the patient who, the best patient he had, who did all what is needed and traveled and didn't complain and Spanish. It's a point. I have any issue to communicate with nurses, and it was one like it's kind of clear. Well, okay, stay here, do this. Like I learned, and they liked me. Like I spent a lot of time. I mean, coming after the second time to this clinic, other clinic. He even I've had some complication. He take me in like on a weekend. The relationship and attention. And I remember another doctor, like orthodontist, he was working me late night hours, like him and his daughter. I mean, all team of doctors. Like I didn't get such attention in Canada, at least. Like, and eating. And all nurses, they knew me, hola, hola, Emily, ¿cómo estás? And like on this level, and I have full confidence because I've seen how they working, how they get paid. It was more than, it was personal attention.
Yes. And that's key. And it's a shame here in the U.S. because she's been in healthcare her entire life, and she was born. She knew that she wanted to be a nurse, and she'll probably kick me for sharing this publicly, but she lived on a farm, and at 3 years old, she would wander out in the field with a Kleenex to wipe the cow's nose because she thought it was sick. So she knew she wanted to be a nurse from a very early age. And because of the pressures in the American system now, she said nursing is not the same as it was when I was younger. So there's a lot of pressure. The medical staff, I mean, my in-law is a physician, and they just parade patients in front of him all day long. He works 12, 14 hours a day. My wife works 15 hours on her shift. So it's not a matter of not wanting to give the attention. It's just that they're spread too thin. They're spread too thin here in the US. And that's a good point also, because overseas, the countries that we do business in, they have separate wings. They have separate wings for international patients. So you have the general population that gets treated, say, in Building A, and then you have the international population that gets treated in Building B. And they understand that Americans pay more money. And again, you're not going to get the same price that a local will get. They understand that you're an American and it's going to be higher than what the locals pay there. But it's still much, much less than what you'll pay here in the US. But the service, the ability to give the attention to the patient. And in Thailand, they treat the patients like kings and queens. Like kings, literally kings and queens. Now, again, we have hospitals. The CEO of one of the hospitals is a friend of mine. So we have hospitals in Thailand, but we look more towards Latin America, simply because the cultures are more similar to the majority of Americans, and the time travel. I can tell you from experience, that's 17 hours going over to Thailand. That's not fun.
That's why I decided not to go to Hungary, and because it will be not very convenient. Even I like Budapest and all this, and it's what I proposed, at least in my capacity, as Americans. I say there is Costa Rica, Mexico, they're on high level professionally. Obviously, you can find some issues, but back home, what is interesting, my dentist, like actually it was surgery, it was a surgery, he provided me life warranty. And when I was standing back home in Toronto, I have a local dentist. Like, how it can be warranty? It cannot be warranty on medicine, like on his work. On dental, I have German implants and some materials that I was selecting. He was explaining me, because I asked him, what's this material? How's this done? What's the advantages between different German brands and Switzerland brand? They have variety, whatever we didn't have in Canada and United States. Actually on a budget, based on condition, how it should be. As a doctor, he provided me warranty, and I was laughing. I say, life warranty, it's kind of my life, your life. What do you mean? He told, warranty on my work, free, which I was very impressed, because I always heard back in Canada, like in medicine, we are not kind of nature of the work, we are not giving warranty. But I told, person is like it's warranty of his professional conduct and work. I mean that I can come to him for free. Not on all. It was kind of written what is, like material, not. But for work, he will kind of redo it And I was impressed.
And again, I mean, the level, and that's where knowing who you're working with.
Mhm.
And I always go back to for people that want to do it themselves, is you don't know what you don't know.
Yeah.
You don't know the right questions to ask. You don't know the various permutations of what could happen. And I want to go back to what you said about it has to do with the warranty, but it also has to do with what you said earlier about physicians, or in your case, a dentist, didn't want to touch what you were doing. Okay. And that is something to consider when you're having something done. What happens if something does go wrong?
Yeah.
Okay. Before I actually started Salud Health USA, my stepdaughter actually had a procedure that we had no input on. It was her and her husband. They did it without our knowledge, and she had a procedure that became very complicated. And the general consensus in the U.S. is physicians don't want to work with that. Physicians here in the US don't want to fix somebody else's problem
Absolutely.
because after the fact, because of possible malpractice.
But they don't want to fix
And
their own problem, not only somebody else.
well, exactly, exactly. But that's one thing that we took very, very seriously when I did start Salud Health USA, is I was adamant not only about vetting the providers to the umpteenth degree, but also to have someone in the US, a revisionist, that would fix a problem if it occurred. And just for the record, it's never occurred. Another company that has been in business for 12 years, and they've never had an issue. Okay. But we have revisionists. So in the case of my stepdaughter, it was a bariatric surgeon. It was the bariatric surgeon that did take her on and saved her life and fixed her. And she's 100% now. And this is a good 10 years ago. But she's 100% healthy. And he's part of our network. He's part of our network and has agreed that any bariatric problems he will take care of. And again, we haven't had anything. We also have orthopedics, different types of procedures, just in case. Just in case. But by and large, our experience has been 0%. Our patients have been happy. A recent patient just came from Mexico, and she had bariatric surgery. And she is pleased and tickled pink. She actually has lost something like 60 pounds already. So she's extremely, extremely happy. But that's something to consider as well, though. It's you don't know what you don't know. And it may not be important in the beginning, but once luggage is lost, or once you're lost on a street corner somewhere, that becomes the most important thing to you. So you want to have as much assurances and procedures in place to be able to handle those sorts of things. Loss typically covered on travel policies. But if you don't know which travel policy
no, I understand.
purchase,
Concierge services is excellent. I mean, as idea, as implementation. And I was, by the way, waiting how this company was working in this regards as well. Like they've had it in place. I mean, driver take you from airport, like it's all taken care of in good clinics in Mexico and in other countries. But with all these people concerned about safety. Yes.
yes,
Safety. And I know, first of all, people from different culture, I think, have different tolerance level. Americans very used
exactly.
to comfort zone level is different, and expectation and requirements are high. Telling the truth, like for me, even if like one office of my doctor in Costa Rica, like in the center of the city, was not the medical building, but not the newest, I would say. I was
Mhm.
comfortable with this, and because the care was excellent, I was okay. So it's not so new. After then, I was in his other clinic in Escazú, like it's upscale neighborhood, and of on American level. But it was not. I know that other people would say, "Oh, like what kind of office and what kind of." But we are for our customers, and we need to anticipate data level, and specifically when people feel not all kind of is important. And safety in United States, like there is insurance, there is kind of revisionist, as you say, the body to kind of look at you, even not happy, go through all this process. So what you would say, you would ask for people who ask like, what about safety with procedure in other countries?
Okay. Say, as you mentioned, people have certain tolerances. And I was in Chile, and there was a lot of protests going on during the time that I was in Chile. But we have local partners in all of our countries. We have local partners that know the neighborhoods. They know routes. You don't go down this street, you don't take that route,
Mhm.
etc. Because in every city in the US, there's good areas and there's bad areas. And again, that's something that's really pretty difficult to research on your own. Okay. But they have actually turned down a hospital. Their care was excellent. Their care was absolutely excellent. But the location that they were in was a very, very rough part of the city. And we knew that our clients would be uncomfortable traveling to that particular facility. So we politely declined their requests to join our network. But as long as you are aware, and every country has its negatives. An example, Colombia. Okay,
Mhm.
we do a lot of business with Colombia. And Colombia, prior to 2016, there was a chance of getting kidnapped. All right. But in 2016, the largest government guerrilla organization signed a peace accord, turned in over 7,000 weapons, and became a political party.
Yeah.
And matter of fact, one of the former leaders is actually the current president of
Yes.
Colombia.
No, yeah.
So the I mean, it's important to pay attention to geopolitical situations as well. Now the biggest concern is having your cell phone snatched. That's the biggest concern. They don't have the violent crime on the level that, say, the US does. I was actually in at 10 o'clock at night walking the streets in El Centro, which is downtown.
Mhm.
And I felt much safer there than I did walking around New York City at night.
I
So it's information. Honestly, it's just education. It's education and information that will help the person that's considering having a medical procedure done outside of the US or Canada to simply work with somebody that knows the project. And one of the things I will say is you want to ask these questions of any medical facilitator because not all medical facilitators are the same.
Mhm.
Many are simply travel agents that
Mhm.
basically facilitate the flight, the hotel, and they'll get a commission from the hospital. And that's all. That's all they do because that's how they're paid. So when looking for a medical tourism facilitator, you want to find one that is completely dedicated to that and have the various controls and quality controls that we talked about previously.
Okay, now a little bit close to our borders. I mean, it's about Mexico. You have clinic in Mexico. Do you have any kind of expansion plans, and what people can expect from Salud Health in this regard?
Yeah, okay. Well, yes, we do. We actually have a network of I think it's 26 hospitals in
Mhm.
Mexico. And by far, that's our largest number of hospitals. We have about 50 within our network globally.
Mhm.
Okay, but Mexico is by far the largest simply because of the proximity. It's so close, and obviously in Tijuana, that is a simple 20-minute drive from San Diego. So it's a very, very close destination. Nevada from Las Vegas. She flew over to San Diego, and then our hotel drove her across the border to the hospital, Tijuana. She had the procedure done, and she stayed there. I think it was a day, and then she was taken back to the U.S. So it's extremely cost effective and convenient, but there are certain procedures that are only done in certain hospitals.
Absolutely.
Okay, so we have a hospital in Mexico City which requires a flight down to Mexico City.
Yeah.
And again, we have relationships with the hotels. Oh, I want to share this because I thought it was interesting. It's important to understand that as a customer, you will get quoted a certain price. You'll get quoted a price. If you did it yourself, they'll, okay, what's your cost for this? And they will tell you. And our customer that was in Mexico and Tijuana recently for the bariatric surgery, I told her what the price was, and she goes, "Well, they told me it was something like it's higher. It was they told I can't remember the exact figures, but I think it was 6,000, and I told her our price was 5,400, and she goes, "Well, it's less."
Because you have
And I
special
said, "Well, yeah,
related.
because of volume, because of relations that we have built over the years, these hospitals, not all of them, not all of them, typically will give us a lower price than what it would cost somebody to go and just call around and do it themselves." So she actually wound up saving money and had an excellent experience. As far as expansion plans, goodness, there's a lot. We've got a lot of. Part of my background has to do with international hospitality, and currently one of my good friends is putting together a an eco wellness hotel
Well,
in Colombia on the beach.
okay. I like it.
Okay, that is going to be all about, you mentioned it in the beginning of the interview, uh, medicine
Mhm.
treatments, yoga, acupuncture, mindfulness, meditation, all those sorts of things. And they're building an entire resort around this. So we're looking at working with them and expanding into that. We're also looking at mental health as well as substance abuse. One of
Clinic?
the things that, I'm sorry,
You speaking
can you
about
repeat?
clinic, hospital? Mhm.
Clinics, clinics. Because here in the US, for substance abuse, that's extremely expensive. Extremely expensive. There's a facility in Arizona that has something like I think it's 10,000 a week. So it's very, very expensive, and it's like a 6-week program. So the opportunity is there to duplicate what they're doing in Arizona, but at a drastically reduced price point. And people don't need to know because there's typically a stigma with that going to a clinic for substance abuse. But they just said, yeah, I went down to Colombia for vacation for 6 weeks. It was wonderful.
Yeah, in Mexico, I even knew a couple of in Riviera Maya. I mean, eco wellness centers and substance abuse, and they use different method of treatment.
Absolutely.
Yeah.
Oh, I'm glad you mentioned that because I did want to mention this as well. One of the things that our corporate clientele has been interested in, and it's very low barrier for their employees because they don't want to say we're gonna send you to another country for your health care. All right. The employees don't look at that as a benefit all the time, although many of them do, is executives. And executive physicals are top to bottom physicals that uncover potential problems before they become problems that are expensive or difficult to treat. Now, those types of
Prophylactic.
physicals, they are done here in the US. The Mayo Clinic does that, and their cost is anywhere between $10,000 and $12,000. In Colombia, we can get the same. Actually, I can't say same because some of the tests may be different and not an exact match, but we can get that similar executive physicals for about $1,200. So it is much less expensive. And I like to tell this story because it demonstrates this legislation. So I was back and forth to Washington, D.C. quite a bit during that time, during that period. And one of the congressmen that I worked with was a freshman congressman. He had just been elected, 38 years old, young congressman, avid runner, avid runner. And because he became a congressman, he was given an executive physical. He was in surgery the next week. He was in surgery the next week because he had an occlusion in his heart that he could have dropped dead on the pavement running one of his marathons, and they wouldn't have found out about it until the autopsy. So it can uncover potential problems way before there's a catastrophic
Yeah.
event. Other thing we're looking to is gene therapy, stem cells. We also have we have this now, a behavioral health model, socio-emotional learning tool. So it helps children that are having some difficulties with adapting or working with their have day to day via virtual reality. So we have there's a lot of things. There's a lot of things that we're looking at doing. Telemedicine is big right now. We have international telemedicine. So if you're having an issue, you get a cold, for example. Let's say you get a cold and you're in another country, have something done, a procedure done. All right. We're able to actually have an international doctor talk with you about your cold and prescribe medications and work in conjunction with the treating surgeon in the country that you're in.
Great. So it's all very interesting, and there are so many questions and really a kind of a situation and stories. If you can just summarize what kind of treatment would help some to Americans.
Well, obviously the executive physicals
Okay.
anybody can do. Anybody can do. The corporate marketplace has adopted them, but anybody can do the executive physicals. Obviously we do cosmetic, but what we really have a lot of interest in is bariatrics, as I had mentioned. Cancer is a big thing because that's not so much cost as it is availability for
In United
treatment.
States.
Okay. There are innovative, effective treatments globally that may not be available in the US. And then also
Yeah.
orthopedics. I mean, orthopedics, real quick example. A knee surgery may be $65,000 retail here in the US for a knee surgery. And my daughter just had this done, so I know those figures are accurate. There's a $9,000 out of pocket for the patient nowadays. Okay. If you have insurance, $9,000 is your out of pocket, but the company winds up paying $23,000 of that. But the entire package, travel included for two people, because you're going to want to have somebody go with you.
Mexico, Colombia?
That's in Colombia. That's in Colombia. In Mexico, it's about 12,000. In Costa Rica, it's about 15,000, which incidentally, the Medicare rate is 17,000. So that's what they'll pay, what Medicare will pay for a knee surgery. So by utilizing medical tourism effectively and intelligently, companies can wind up saving literally millions on their employees' health.
And I remember or heard like witnessing dental clinics in Jeremiah. For example, they've had agreement with Green Shield, with some insurance companies up north about kind of taking the treatment, because companies were happy to send actually employees for the treatment to Riviera Maya because they were saving a lot of money. Even people were flying and taking hotels.
North Carolina that has been doing, and they wind up saving, and they're a small company, 200 employees, and roughly 10% of their employee population utilize medical tourism. Now they do it in Korea. They actually do it in Korea, but the savings are definitely there. The quality is there. It's a perception that perhaps the quality may not be as good as the US, but I'm here to tell you it is. It is, and there are organizations out there that can accredit that and say this hospital does excellent work.
Excellent. And the last question, where people can find how they connect, how better to connect with you or with a company. We'll put later on the information, but for people to listen and what you would say.
Absolutely. I mean, they can always go to saludhealthusa.com and they can email directly. It's danh@saludhealthusa.com or info@saludhealthusa.com. All of those work. Our number is on the website as well. That's the best way to reach out to us.
Thank you, Dan. And today we listened, we enjoyed, we learned from Dan Heffley from Salud Health USA. Thank you, everyone. Thank you, Dan.